A 68-year-old patient with chronic heart failure is admitted with worsening shortness of breath and fatigue. The nurse reviews the following data: blood pressure, that is 88 by 54 mm of Hg, heart rate 56 beats per minute, respiration, that is 26 beats per minute, crackle in both lungs, SpO2, that is 89% on the room air, urine output 20 ml per hour, potassium 5.8 milliequivalent per liter, creatinine, that is 2.3 mg per deciliter. And current medication going on is lisinopril, metoprolol, spironolactone, and furosemide. So, which action should the nurse take first? A. Administer scheduled metoprolol, hold spironolactone and notify the healthcare provider, increase oral fluids, administer IV furosemide. So one lab value, one medication, and your heart failure patient can crash in a minutes. So let's make sure that NCLEX never tricks you on this topic. And heart failure is one of the most tested topics on the NCLEX exam. So hi everyone, welcome back to ManpreetRN Talks. So in this video, I will show you how to think, prioritize, and answer heart failure question like a nurse. So heart failure that does not mean the heart has stopped. It means the heart cannot pump blood effectively enough to meet the body's oxygen and nutrients demand. So the heart fails to maintain adequate cardiac output, that is the oxygenated blood pump out to our body. So due to this, there is impaired pumping ability of the heart. So as a memory tricks, you can remember heart failure, that is the failure to pump blood forward. So heart failure that you can remember, heart failure is heavy fluid. So heavy fluid backs up in our lungs or body. So there is water gain and weight gain. Why this is dangerous? So that the tissues don't get enough oxygen because the blood that cannot reach to the organs, vital organs such as kidney and kidney, liver, and other our body organs, brain as well. So when kidney sense low blood flow, then and body compensate, that compensation makes heart failure worse. So cardiac output is equal to heart rate into stroke volume. So, what means by stroke volume? Stroke volume is the amount of blood that is pumped out by our left ventricle of the heart in one heart contraction. And cardiac output, that means the amount of blood the heart pumps in a 1 minute. So normally is 4 to 8 liter per minute. So cardiac output is equal to stroke volume into heart rate. So if the cardiac output is decreased, that means stroke volume is also decreased and less blood pumped per beat and organs suffer. So there is less oxygen to the every organs, and it means their patient may feel fatigue, confusion, renal failure. So fatigue is the early sign of heart failure. So, what are the causes for heart failure? And there is right-sided heart failure and left-sided heart failure. So, for right-sided heart failure, there is hypertension, high blood pressure, pulmonary hypertension, stiff fibrotic lungs, and left-sided heart failure can cause right-side heart failure. So in right-sided heart failure, there is problem with the blood that blood can't move forward into the lungs that lead to backs up blood into the body. So the causes first is left-sided heart failure, that is most common cause because left ventricle fails. It means blood backs up into the lungs and lungs get congested. There is increased pressure on the right ventricular and right ventricle eventually fails. So left-sided heart failure also lead to right-side heart failure. Second is pulmonary hypertension. Pulmonary hypertension means high pressure in the pulmonary arteries. So right ventricular must pump harder to push the blood into lungs. So over time, right ventricular becomes very weak and fails to pump out. So causes for the pulmonary hypertension can be COPD, pulmonary embolism, and chronic lung disease. Next is chronic lung disease as the stiff fibrotic lungs. In case of COPD, pulmonary fibrosis, and the lungs they are become very stiff. There is increased resistance. So right heart, the heart sided will be more workloaded. So it can lead to failure. This is called core pulmonale and right heart failure due to lung disease. The term that is core pulmonale. And systematic hypertension, high blood pressure, because long-term hypertension can affect left-sided heart first, and it can progression, long time progression can lead to right side heart failure indirectly. So causes for left-sided heart failure, there is problem with the weak pump, means left ventricle is not able to pump out blood enough to the body, and that can lead to blood backs up into the lungs. So it may be reason for after heart attack, a myocardial infarction. So heart muscle there get damaged, and left ventricle can't contract effectively, and pump becomes very weak, that can lead to heart failure. And ischemic heart disease, in for this there is a reduced oxygen to heart muscles. It is caused by coronary artery disease and acute coronary syndrome. So chronic ischemia can lead to heart weakness, and that can lead to heart failure. Chronic hypertension, that can also lead to a left-sided heart failure, because left ventricle pumps against high pressure, so that can lead to left ventricular hypertrophy, and stiff ventriculus eventually become very weak, and that can lead to left heart-sided heart failure. So risk factors for heart failure, that is very common, as we have discussed hypertension. It is the first priority risk factor, high BP, that can lead to both damage of the heart muscles, and that can lead to heart failure, arterial fibrillation and other dysrhythmias. Third one, mitral valve regurgitation, that can also lead to heart failure and cardiomyopathy. So sign and symptoms, what is very important for NCLEX exam. So in the exam, questions are asked about the right-sided, what are the sign and symptoms of right-sided heart failure, and what are the sign and symptoms of left-sided heart failure. So you should remember for this. So for if there is right, so R, right-sided heart failure. So you can remember right side rocks body with fluid. And left-sided heart failure, there is L, L means lungs, so lungs, lung fluid. So you can remember easily. So right side there is rocks body with fluid. There is over volume that is in our body, and in the left side there is always lungs involvement is there. So first we will discuss right-sided heart failure. So in that there's peripheral edema. So peripheral edema, weight gain, okay, because there is water inside the body, jugular vein distension, abdominal growth like ascites, there is fluid in abdomen, hepatomegaly, because big liver, there is fluid accumulation also in the liver, splenomegaly, big spleen. These all symptoms are happen because right ventricular fails to pump blood to the lungs. So blood backs up into the systemic circulation. So increase venous pressure and fluid that leaks into our tissues. As a result, so there is these symptoms occurs like peripheral edema, jugular vein distension as the high vein pressure, ascites, hepatomegaly, weight gain, and in the GI there is GI congestion, anorexia, nausea. For left side heart failure, there is lung involvement, so pulmonary edema, patient have crackles in their lungs, rays that don't clear with cough, pink frothy, blood tinct sputum, that is very important, and orthopnea. Orthopnea is difficulty in breathing when lying flat. So why this all happen? Because left ventricle fails to pump blood into our systemic circulation. So blood backs up into the left atrium, and that it goes back to pulmonary veins, and then it goes to lungs. So there is increased pulmonary pressure and fluid leaks into alveoli. So exchange, there is impairment of gas exchange. So patient feel crackles, shortness of breath, dyspnea, pink frothy sputum due to pulmonary edema. For diagnostic purpose, what are the diagnostic tests are done to diagnose left-sided or right-side heart failure? First is lab investigation, that is BNP, brain type nephropathic peptides. So that is done because B means broken ventricular. You can remember from BNPB, that is broken ventricular, because BNP that is released when the ventricles they are overstretched. So high BNP means fluid overload, and the BNP decrease, that means there is improvement. So remember, over 900, that means can lead to severe heart failure. Then we can do echocardiogram that measure the ejection fraction. So ejection fraction is the blood pumped out of the heart. That is the percentage. So normal is 55 to 70%. If there is 40% or less, that means bad, that can lead to heart failure. Then the hemodynamic monitoring. So a term that is the Swan scans, that is the pulmonary artery catheter that is used for the diagnostic purpose of heart failure. So it basically measures pressure inside the heart and lungs. So normal value, that is 2 to 8 mm of Hg. So if there is over 8 mm of Hg, that is not good. So it means high pressure fluid leaking that backing up into the lungs, there can lead to pulmonary edema. So what are the priority intervention? So for pulmonary edema crisis means lungs, they are filled up with the fluid. So as keywords you can remember in the exam, there if their keywords they are written, so you can remember it is pulmonary edema crisis. Like patient is having new, sudden, worsening, rapid symptoms. So first action is furosemide. Means furosemide, that is the diuretics, remove excess fluid, decrease preload, and relieve congestion. So next is head of bedside, that should be at 45-degree or higher, semi-fowler position, high fowler positions as orthopenic position because patient is having difficulty dyspnea. So we'll provide the position for then. After that, we will apply oxygen to the patient and push furosemide, morphine, and positive inotropes, and we will check and sodium and potassium level as well and fluid because sodium swells the body, and so patient should be asked to not drink fluids and stop IV fluids. Remember, so you can remember the word hope. So H means head of the bedside should be elevated like 45-degree angle, semi-fowler or high fowler position. Then oxygen, P for push, furosemide, morphine, and positive inotropes to maintain the blood pressure as well. And E, that is and sodium and fluids. So there is no sodium, and sodium swell because sodium swell the body, it lead to water retention in our body, and patient should be restrict from drinking fluids and stop IV fluids as well. So you can remember as a question we do, a client with chronic heart failure took cold medicines for her flu. She presented with new productive cough with pink frothy sputum and worsening crackles. So what action should the nurse take first? So look for keywords that is new, sudden, worsening, rapid symptoms. So first action is furosemide. So because give diuretics. So now you can see in the options A, assess lung sounds, give butenamide IV push, notify healthcare provider, and clock out for lunch. So correct answer is give butenamide IV push first. So now we will discuss about pharmacology and care. For pharmacology, you can remember A, B, C, D, 3D. So A is AC inhibitor and ARBs that lowers the blood pressure. B for beta blocker that lowers heart rate and blood pressure as well. C, that is calcium channel blocker. It also lowers the heart rate and blood pressure. D, digoxin. Then again D is dilators, that is vasodilators, and D, diuretics, that is lowers the blood pressure and remove extra fluids from the heart. So for diuretics like Lasix, they use to remove excess fluid and decrease preload and as well as relieve congestion. So always monitor potassium, blood pressure, and dehydration for if patient is using diuretics. Then is the AC inhibitors because AC inhibitor what they do, they blocks the RAS system and decrease preload and afterload, so slow disease progression. So always watch for their side effects like dry cough, hyperkalemia, angioedema, that is the very side effect from the AC inhibitor. Beta blockers, they are used to reduce myocardial oxygen demand, decrease heart rate, and improve survival long term. So if patient they are using beta blockers like atenolol, so atenolol, labetalol, there is and lol, and so it blocks both BP and heart rate. So always check for bradycardia, heart rate less than 60, and blood pressure that should not be less than 90/60. So hold if patient is present with this acute exacerbation of chronic heart failure. B for breathing problems. If patient is having asthma and COPD, we do not give beta blocker because it can lead to bronchospasm, and it also blood sugar masking, like they hide the diabetic sign and symptoms. So we in patient with diabetic, we give very consciously. Next is calcium channel blocker that end with the dipine, like nifedipine, amlodipine. So they calms the blood pressure and heart rate. So always check heart rate and blood pressure as well for these. And for diuretics, I also explained so that diuretics can drain the fluid from our body. That is two type potassium fasting and potassium sparing. So potassium fasting means that like potassium waste from our body, like furosemide, hydrochlorothiazide, that are the examples. In that, you usually check for low potassium. Eat Patient should be asked is about eat melons, banana, and green leafy vegetables. Next is the potassium sparing, that for example, spironolactone. It spares the potassium, means add potassium. So avoid salt substitutes, melon, green leaf vegetables. Next is the dilators, that is the vasodilators, for example, nitroglycerin, isosorbide. So they extremely low our blood pressures. We broadly dilate the blood vessels. So all if patient is using nitroglycerin, and that should not be given with Viagra, that is the substance like and with the fill like sildenafil, that can lead to very severe reaction and patient could be die. So and nitro dip should be stopped if the patient is blood systolic blood pressure that is 90 less than 90 mm of Hg and suddenly dropping by 30 mm of Hg. And adverse effect of nitroglycerin that is very important is the side effect, that is headache, and the patient is having orthostatic hypotension. So if patient is on these, so always teach the patient to slowly change their positions. And last, D, that is the digoxin. Digoxin is an inotropic for that patient with heart failure because digoxin, what they do, it digs for a deep contractions. It do deep contraction, increase the contractibility of the heart. But if patient is using digoxin, if patient is on digoxin, you should remember check apical pulse for 1 full minute and it should be more than 60 beats per minute, and hold if the less heart rate is less than 60 beats per minute. And toxicity, always check like vision changes, nausea, vomiting, blurred vision, and potassium. So digoxin toxicity can lead to hypokalemia and potassium level 3.5 and less than that. And in addition to that, one inotrope, that is the milrinone that is also used as a last line therapy for palliative care if the patient blood pressure is not maintaining by all that. Next, we are going to discuss about diet, what diet patient should have to take. So that is low sodium and fluid restriction. What it means, sodium less than 2 gram per day and fluid that should be 2 liter per day or less. So why? Because sodium cause water retention. So more water that can lead to increased preload, and that is the increased workload on the heart. So that can lead to always worsening edema and pulmonary congestion. So always teach the patient to avoid processed foods, because processed foods, packing food that have salt intake, and read the food labels as well, not add too much salt in their diet, and limit soup, pickles, chips, cane fruit juices as well. Then patient is having risk for fall. So why heart failure patient fall? Because the patient is on diuretics, ACE inhibitor, beta blockers. They always decrease the blood pressure as well. So always teach the patient that can lead to orthostatic hypotension. So as a nurse, we have to assist patient when they are standing. Always teach the patient while they are standing. Always sit before standing, and bed alarm should be placed on patient bedsides, because dizziness and BP meds that can lead to increased risk for falls. Next one is BP and BNP that should not be increasing. Why? because there is heart failure means lower BP. So sudden increase in BP that can also worsening heart failure. And BNP that, as we have discussed, brain natriuretic peptide, that then when they are released, they release when ventricles they are overstretched. So high BNP means fluid overload. So that should be decreasing. If there is decreasing BNP, that means improvement in the patient health condition. So BNP is the heart failure marker. Next is elevate legs and high. Patient is provide high follower position. So why elevate legs with pillows? Because it leads to improves venous return as well as reduce dependent edema. High follower position it decrease venous return to the heart and improve lungs expansion as well, and it can lead to reduce the dyspnea. Patient is having shortness of breath that improve with this high follower position. Next one is daily weight monitoring. Why? It is the best indicator for fluid status. So why daily weight monitoring is important? Because fluid changes slow up in the weight before edema. So 1 kg means 1 liter of fluid. So worsening heart failure. So always teach the patient if there is increasing 3 pounds in a day and 5 pounds in a week, that can lead to worsening heart failure. So always teach the patient to monitor their weight at same time, same scale, same clothes daily, and daily should be monitored. And next is sex. So patient always ask if they can do sex or not. So I always teach the patient if they are able to 2 flights of stair with no shortness of breath, that a patient is able to walk, able to climb on the stair, 2 flights of stair with the no shortness of breath, then it can do. They can do so because sex that is the physical exertion. So heart failure patient may got dyspnea. Next is the stockings, that TED stockings, TED hose. So why they are used to prevent blood pooling, so decrease venous stasis and always decrease edema as well. So apply in the morning as we have to teach the patient, and remove daily, check their skin because it can lead to impair skin integrity. And one more important thing, if patient is having severe PAD, peripheral artery disease, in that case we do not use stockings, and there is skin breakdown, so do not use stockings as well. So remember this NCLEX mnemonics for heart failure nursing care, that is the DRBEDSS. So why do we think this is heart failure? So always remember this mnemonic so you can remember all the care. And one important thing always, no over-the-counter medications like cough, flu, antacid or NSAIDs, because it can lead to worsen the heart failure. Because most of they contain decongestants like pseudoephedrine, phenylephrine, because these cause vasoconstrictions, means increasing blood pressure, increasing heart rate, and increasing cardiac workload. So in heart failure patient, there is heart is already weak, so extra workload can worsen the heart failure. And no NSAIDs like ibuprofen, diclofenac, naproxen, because they cause sodium and water retention and reduce the effectiveness of diuretics. So it decrease renal perfusion. So as can lead to decrease, they result in fluid overload, edema, and pulmonary congestion. So in heart failure patient do not give NSAIDs. And antacid, especially sodium containing. So many antacid that contain sodium bicarbonate. So sodium that can lead to water retention. So water retention, it means heart failure worsening. And no canned packed food like chips, sauces, meats, cheese, wine, because they are increased with sodium. And very important, never massage calf muscles in heart failure patients. Heart failure patients, they often have poor circulation, venous stasis, and that is high risk for DVT. So if you massage the calf muscles, so a clot can dislodge, travel to lungs, that can cause pulmonary embolism, that can be fatal. So suspected clot, so never massage. These words like edema, calf tenderness, bed rest, so do not massage the calf muscles. So let's do practice question on heart failure. So question number 1. Captopril, furosemide, and metoprolol are prescribed for a client with systolic heart failure. The client's blood pressure is 136 by 82 mm of SG and heart rate is 65 beats per minute. Prior to medication administration at 9, the nurse reviews the following lab tests. Just below, see the charts. What should the nurse do first? Administer the medications, call the healthcare provider, withhold the captopril, question the metoprolol dose. So correct answer is 3. The nurse should withhold the dose of captopril because captopril is an AC inhibitor. As a side effect of this medication is hyperkalemia. The BUN and creatinine, which are normal, should be viewed prior to administration since renal insufficiency is another potential side effect of an AC inhibitor. The heart rate that is within normal limit. The nurse should caution the dose of metoprolol if the client's heart rate is bradycardic and the hemoglobin and hematocrit that also are in normal range. Then nurse should report the high potassium level and that captopril was withheld. Next question. A client was admitted with an exhibition of heart failure breath at 2 and at 7. And at 7, which information is most important for the nurse who admitted the client to communicate during the handoff care report to the nurse who will next take care of the client? First, admission weight of 210 pounds, elevated B-type natriuretic peptide of 600 mg per ml, reaching 250 ml by incentive spirometry, and urine output of 120 ml. So correct answer is 4. Urine output is less than expected minimum of 30 ml per hour. So if the urine output does not increase, the nurse who will next care for the client should report the decreased urine output to the healthcare provider. An elevated BNP that is expected with the acute heart failure, the level of that the client can reach the incentive spirometry that is good to know but it is most essential finding to report at this time. The admission weight is helpful only if a prior or baseline weight is also provided. So correct answer is 4. The urine output is that is less than as expected. Normal urine output is that is the 30 ml per hour. Next question. A client with chronic heart failure has atrial fibrillation and is taking warfarin. What should the nurse tell the client about the expected outcome of this drug? Option A, this medication will decrease the extra fluid from your heart circulation. Second, this medication will improve the work of your heart. This medication will prevent a clot from forming, and this medication will regulate the rhythm of your heart. So correct answer is 3. This medication will prevent a clot from forming. So warfarin that is anticoagulant. Next question. A client with heart failure is taking furosemide, digoxin, and potassium chloride. The client has nausea, blurred vision, headache, and weakness. The nurse notes that the client is confused, and the telemetry strip shows first degree AV block. What other symptom sign should the nurse assess next? Hyperkalemia, digoxin toxicity, fluid deficit, and pulmonary edema. So correct answer is 2. Digoxin toxicity because early symptoms of digoxin toxicity include anorexia, nausea, vomiting. Visual disturbance can also occur, including double or blur vision and visual holes. Hypokalemia is a common cause of digoxin toxicity associated with arrhythmia because low serum potassium can enhance the ectopic pacemaker activity. Although vomiting can lead to fluid deficit, given in the client's history, the vomiting is likely due to adverse effect of digoxin toxicity. So pulmonary edema is manifested by dyspnea and coughing. So correct answer is digoxin toxicity. Next question. The nurse should assess the client with left side heart failure for which findings? Select all that apply. Dyspnea, jugular vein distension, crackles, right upper quadrant pain, oliguria, and decreased oxygen saturation level. So correct options are first, third, 5, and 6. Dyspnea, crackles, oliguria, and decreased oxygen saturation are the sign and symptom that is related to pulmonary congestion and the left-sided heart failure. And inadequate tissue perfusion also associated with the left-sided heart failure. Jugular vein distension and right upper quadrant pain, along with ascites, edema, are usually associated with the congestion of peripheral tissue at right-sided heart failure. Next question. Which are indication that a client with a history of left-sided heart failure is developing pulmonary edema? Select all that apply. A. Distended jugular veins. B. Dependent edema. C. Anorexia. 4. Correct crackles. 5. Tachycardia. So correct answer are option 4 and 5. Signs of pulmonary edema are identical to those of acute heart failure. Signs and symptoms are generally apparent in the respiratory system, and it include chorus crackles, severe dyspnea, and tachypnea. Severe tachycardia also occur due to sympathetic stimulation in the presence of hypoxemia. Blood pressure may be decreased or elevated. It basically depends on the severity of edema, jugular vein distension, and anorexia are symptom of right-sided heart failure. An older adult with a history of heart failure is admitted to the emergency department with pulmonary edema. During admission, what should the nurse assess first? Blood pressure, skin breakdown, serum potassium level, and urine output. So correct option is answer is first. It is a priority to assess blood pressure first because people with pulmonary edema typically experience severe hypertension that require early intervention. The client probably does not have skin breakdown, but the client is stable when the nurse obtain a complete health history, and the nurse should inspect the client's skin for any signs of breakdown. However, when the client is stable, the nurse should inspect the skin. Potassium level are not the first priority. The nurse should monitor urine output after the client is stable. The nurse is caring for an older adult with mild dementia admitted with heart failure. What nursing care will be helpful for this client in reducing potential confusion related to hospitalization and change in the routine? Select all that apply. First, reorient frequently to time, place, and situation. Put the client in a quiet room furthest from the nursing station. Perform necessary procedure quickly. Arrange for familiar pictures or special item at bedside. Limit the client's visitors. Spend time with client. Establish a trustful relationship. So correct answer are 1, 4, and 6. So, as explanation, it is not unusual for an elderly client to become somewhat confused about related to relocated to the hospital, and this may be more difficult for those who has dementia. Frequently reorientation delivered so that the patient can familiar with their environments. So, placing familiar items nearby so that the client can see them and may help to decrease confusion related to hospitalization. And establishing a trustful relationship is very important with every client, but maybe more with this client. And putting the client in a room further from the nursing station may decrease extra noise for the client, but will also make it more difficult to observe the client and maintain safe environment. And procedures should be explained to the client prior to proceeding and should not be rushed. Visits by family and friends may help to keep the client oriented. So correct options are 1, 4, and 6. Next question. The nurse is assessing a client with chronic heart failure who is demonstrating neurohormonal compensatory mechanisms. Which are the expected findings on assessment? Select all that apply. Decrease cardiac output, increase heart rate, vasoconstriction in skin, GI tract, and kidneys, decrease pulmonary perfusion, and fluid overload. Correct answers are 1, 2, 3, and 5. As an explanation, heart failure can be a result of several cardiovascular conditions which will all affect the heart's ability to pump effectively. The body attempts to compensate through several neurohormonal mechanisms. So decreased cardiac output that stimulate the aortic and carotid baroreceptors which activate the sympathetic nerve system to release norepinephrine and epinephrine. This early response increases the heart rate and contractibility. It also has some negative effects, including vasoconstriction of skin, GI tract, and kidneys, decreased renal perfusion due to low cardiac output, and vasoconstriction that activates the RAS system that result in antidiuretic hormone. So this causes fluid retention in order to increase the blood pressure and therefore cardiac output. So in the damaged heart, this causes fluid overload. So there is no parasympathetic response. So decreased pulmonary perfusion can be a result of fluid overload or pulmonary disease. So that's all about heart failure. So heart failure is not about memorizing everything. So if this video is basically about prioritizing the things. So if this video helped you understand heart failure better, so please like, save, and don't forget to subscribe Manpreet RN Talks for more NCLEX focused nursing content. So comment below if you want more difficult heart failure questions, medication. So study smart, think like a nurse, and you will pass the NCLEX. So I have asked a question at the beginning of this video. So drop your answer in the comments and let's see who is thinking like a nurse.